With sensitive patient data at stake, healthcare providers need a solution that can keep their files secure, while also enabling easy collaboration across different teams and organizations. This can include medical records, imaging files, and other sensitive information that needs to be accessed by healthcare professionals across different locations. By implementing a modern global file service, doctors and staff members at each practice can securely access and share patient records with the other locations. For example, if a patient has a checkup at one of the satellite practices, the doctor can easily view the patient's medical history and records from any of the other practices, including any lab results or diagnostic imaging. This can help improve patient care by ensuring that all healthcare providers involved in a patient's care have access to the same up-to-date information. It can also save time and reduce the risk of errors, as doctors don't need to spend time coordinating with other practices to obtain records. Furthermore, if a patient needs to be referred to a specialist or receive care at the main hospital, their records can be easily shared with those healthcare providers as well, enabling seamless transitions of care and reducing the need for duplicate tests or procedures. The Peer GFS Global File Service from Peer Software can provide end-to-end encryption, granular access controls, and other security features that healthcare organizations need to protect their data. Let's expand our example. One of the customers in the United Kingdom ran a couple of GP or general practitioner doctors' surgeries. These were affiliated with a general hospital run by an NHS trust. The GP doctors could be working at one surgery in the morning and the other in the afternoon. The Peer GFS Modern Global File Service monitored the file storage both at each of the surgeries and at the general hospital, so that whenever a file was created or modified, that file event was immediately copied from the location it occurred to each of the other locations. That provided a copy of the data at each location that was constantly kept up to date. It meant that when GPs travelled between surgeries, their latest files were already there waiting for them. Moreover, the data was shared with the general hospital such that if a patient required less general and more specialised hospital treatment, all of the relevant patient data would already be there too for the hospital doctors and clinicians to access. To prevent a file from being accidentally overwritten when two or more doctors tried to modify their local copy of a file at the same time, the Global File Service included real-time file locking. This meant that only one doctor could edit a file at a time. Others, regardless of which location they were situated, would still be able to read the contents of the file, but it would be read-only. So, all of the people would have access to the content of the file, but only one would be able to make changes at a time. And from a performance perspective, having fast, local access to the latest data is always going to be faster than accessing them remotely across a site-to-site network or the internet. In the healthcare industry, it's so important for systems like this to be robust, reliable, and available. People's lives can literally depend on a doctor's ability to have timely access to their patient data. A global file service can help in the event of a disaster or IT outage. For example, if file access at one of the doctor's surgeries became unavailable because of a storage failure or some other kind of outage, those users could be automatically switched to use the other surgery's copy of the data or even the files at the general hospital. In short, they could keep working during the outage using another copy of the data. Healthcare providers need to be mindful of their budgets. So what does the convenience and safety provided by a modern global file service cost? Let's just say that there is a low entry price per user when compared with other common applications like those used for backup or antivirus. The pricing starts low for small organizations who need to synchronize files between just 2 locations, and the solution is flexible enough to scale up economically for even the largest of healthcare organizations. Every organization's IT infrastructure has nuances and uniqueness to it, so for indicative, no obligation pricing, the best thing to do is reach out to your local peer representative. You can find your local peer office at peersoftware.com/contact. You can, of course, also get in touch with your preferred supplier or reseller. You provide vital help to hundreds of people every day, and at Peer Software we genuinely want to thank you for this. Let us help you with a modern global file service to support the amazing work that you do. You can find out more information and optionally request a free no-obligation trial by browsing to peersoftware.com/peergfs.